I want to thank everyone for being here today and giving me this opportunity to talk about something that I think our university really requires, and within the division of nephrology, but also across all internal medicine specialties, because it's a reality that there's a lot of overlap in the application of genetics to different subspecialties of internal medicine, be it hematology, cardiology, gastroenterology, respirology, oncology, all of them, where there's clinicians requiring subspecialty education and experience and research exposure within genetics. And so my pitch today is for the building of a nephrology genetics fellowship program. So this is Jean, and Jean is 60 years old. She says, I've lived a healthy lifestyle. People have told me that my blood pressure's been high before. I try to remember to take my medications. Maybe I smoked for a few years when I was in my 20s, but other than that, I'm healthy. And then my family doctor just told me my kidneys aren't working good, and here I am seeing you. And unfortunately, the problem is that kidney disease is common. Most people who have kidney disease don't know why they have kidney disease. And all too often, they're left with diagnoses like hypertensive nephrosclerosis or diabetic nephropathy without gold standard diagnostic tests that really identify the underlying cause. Dialysis and kidney failure and kidney transplantation is very expensive, costing over $300 million a year in Canada alone. And while 10% of those with kidney failure have a monogenic, so a single gene genetic cause, there are no Canadian training programs in nephrology genetics. And so I think we can be ahead of the curve and solve this problem. My view is that trainees within a nephrology genetics fellowship training program would gain additional clinical exposure so that they can suspect, identify, and appropriately diagnose heritable kidney disease, that they would gain experience ordering and arranging for diagnostic genetic testing, to gain additional clinical expertise in these patients at high risk of disease progression, and identifying those who would benefit from early targeted therapy, to gain experience counseling patients about the pros and cons of genetic testing, including the ramifications on family members, to familiarize trainees with safe prescription practices and monitoring requirements in patients specifically with genetic forms of kidney disease, and to encourage trainees to pursue careers within either academic or community medicine, but incorporating the tenets of genetic diagnostics in nephrology. And so what's going to facilitate having this training program? So in my last 2 years here, since I came on faculty at McMaster, I've developed McMaster Kidney Genetics Clinic and Laboratory, which really has 3 underlying tenets: providing a clinical service that was not previously available to patients with kidney disease, to perform research into improve our understanding of both chronic kidney disease as well as genetic forms of kidney disease, and then to educate both future nephrologists as well as the general internal medicine trainees about the challenges and strengths of genetic testing. So the mission statement of this kidney genetics clinic and lab is to further define the genetic contribution to kidney disease, translate research into improved care of patients with kidney disease, and educate future clinicians and scientists. My personal leadership statement is that open, honest, bi-directional communication to support team members to innovate, be accountable for their independent decisions, and have an opportunity for growth. What are some of the research opportunities that participants in this will be able to engage? So the genetic epidemiology of CKD outcomes is a prospective observational study of people with advanced chronic kidney disease in which we're doing genetic testing, while Gecko Transplant is a cohort of patients of whom DNA was collected at the time of HLA testing for matching for transplants. And then as well, we have both local and international population level database information and biobanks to access for further substrate for research projects. How will these people be paid? The idea is that they will be post either nephrology, adult or pediatric nephrology training, or medical genetics. There's certainly already a need for additional subspecialty training of Gulf State trainees following their nephrology specialty training. Research awards, either through CIHR and Crescents, these are the ways that I obtained postdoctoral funding. And so hopefully we can seek to find funding through that. And the final way is through clinical scholars, where people would be able to endeavor on some clinical practice to obtain salary while receiving additional training within heritable kidney disease. And so in order to have a successful program, I've reached out, so both Dr. Margetts and myself from nephrology, but then a multidisciplinary expertise in genetics. So Guy Paré in lipid genetics and Mary Pigere in diabetes genetics, as well as Jennifer McKenzie from medical genetics. And really, I foresee, even once we're getting some steam, collaboration with cardiovascular genetics, again, hematology genetics. There's certainly large parts of the curriculum from technology, sequencing technologies, variant interpretation, genetic counseling that would overlap many of the needs in the different internal medicine subspecialties. And so my short-term objectives are to obtain university, departmental, division, and hospital approval for the Nephrology Genetics Fellowship Program. I'm going to begin advertising to increase awareness and attract additional candidates. And my goal is to enroll a trainee into the fellowship program by July 2022 and develop relationships with additional genetics training programs in other internal medicine subspecialties. So with that, I think I've defined, a need both in the clinical and research sphere, the people to provide the training, the opportunity for funding and research opportunities. And so I would like to deliver this program to the university.